The opioid epidemic has devastated local communities, including many in Franklin County. Since 2015, the Franklin County House of Correction has been providing treatment for inmates suffering from opioid addiction. And they've also opened up a facility for female inmates as well. The jail is now partnering with a UMass professor who will study opioid treatment as part of a $1.5 million federal grant. I sat down with Franklin County Sheriff Christopher Donelan, UMass Researcher Elizabeth Evans, and Ed Hayes, Assistant Superintendent at the jail, to learn more.
Opioid use disorders is a very lethal condition. People tend to use it for many years of their life, and it turns out if they go untreated, that's especially the case. The good news is that there are very effective treatments available, but very few people do receive those treatments. When people encounter the criminal justice system, there's an opportunity now to offer those treatments to them. And it turns out that here in Franklin County, they're one of the very few jails in our country that provides evidence-based treatment to treat opioid use disorders.
So we're talking about medication that will be continued once they're in jail.
Yeah, there's 3 different types of empirically supported medications to treat opioid use disorders. So many people know methadone is one that's been around for some time. Maybe a little more recently available is buprenorphine, sometimes known as Suboxone, and then Vivitrol. So those are the 3 medications for which we know are quite effective at reducing overdose risk and improving people's ability to avoid rearrest and reincarceration over time. It's important, though, that they receive the medications and adhere to it over time.
Okay, so how will this grant help the program you've already had up and running since 2015?
Well, it helps with the expansion into Hampshire County. So now both Franklin and Hampshire counties will be doing the medically assisted treatment. And another key component to it is it provides us with a staff to help support our pre-release population when they get released. One of the first and foremost reasons we got into this was the risk that people coming into our pretrial unit were at overdosing and dying when they got released from our facility. So here's what would happen. Someone would go into our pretrial unit, a judge or a probation officer would send them there. They might be there for a week or 2. They would be removed from the drugs that they were taking and also any medications that they were on, and they would go into to detox. They would detox and withdraw. Within a week or 2, they might be released back into the street. And I would refer to them as a drug-seeking missile at that point because they're just trying to find a dealer and just trying to get stabilized again to where they were before. Medically assisted treatment in that unit helps us to stabilize them while they're with us. We give them a prescription and a doctor's appointment when they leave, so they're stabilized on their medication-assisted treatment. And now they have counselors working with them in the community, helping for that transition, helping them to stay on the treatment, helping them to stay with the doctors, helping them to stay stabilized.
So Ed, what do you see, and how many people would you say who come into the facility, have a substance abuse problem?
Well, substance use, we've been assessing for that for some time, and as many as 90% of individuals self-identify as having some form of substance use disorder. In particular, with the opioid epidemic these days, we have a lot of attention paid to that. 40% of individuals self-identify upon incarceration that they've used heroin within the last year. So it's quite significant. And that population's even a little bit, that percent is a little bit higher for our women that are incarcerated in our facility than men.
And how long, Liz, would you say somebody needs to be on that kind of treatment with medication? I mean, how long does it take them to recover?
Yeah, that's really a hard question to answer, and it should be something that patients engage over, discuss with their physician or primary care provider. The evidence indicates that some people may need 5 or more years of time on that medication to achieve sustained abstinence from the illicit use of opioids. So it's important to kind of at the outset understand that it's important to get on the medication, start feeling normal, you're on a steady, appropriate dose of the medication, and that you continue to check in with your provider and assess how you're doing and discuss whether it's appropriate to taper off or to remain on the medication. So we might think of it more as like a chronic condition, a chronic health condition, one that requires maybe long-term management for people to achieve the ability to function in the world.
Why was this so important to you to kind of get out ahead of this, in the jail system and address this crisis?
The primary reason, and we started it in our pretrial unit, was to stop overdoses and deaths. The Chapter 55 report that came out from the state indicated one of the highest risks group of people to overdose and die was people being released from incarceration. So we wanted to stabilize these folks rather than force them into detox and make them unstable, particularly the ones who were under a doctor's care and on a prescription before they came into the facility. We would take them off of that. And they're like, why would we do that? And if somebody comes into our facility on a heart medication or a diabetes medication, we maintain that medication. But they come in on a medication to help them with their addiction, and we force them off of it. That made no sense to me. So that's primarily why we did it in the first instance.
So could you explain a little bit the reason behind opening up a women's facility at the jail and why that was so important to you as well?
Well, it was important to us because we had built an evidence-based cognitive treatment program with medically assisted treatment for our men. And we did it with a lot of support in the community. So a lot of the very active people in the community knew what we were doing for the men. They knew the success we were achieving. And they really came to me and said, why aren't we doing this for the women of Franklin County as well? And it was a good question. So we looked at how we could, without a whole lot of expenditures, expand the treatment we were doing for the men to the women and give them the same access, not only to the medically assisted treatment and the evidence-based treatment program, but also to our reentry services. So that's basically why we opened that unit up there.